start. All right. Good afternoon to everyone who has joined us this afternoon on our session that we have looking at self-advocacy while birthing. During this Black Maternal Health Week, it is important that we talk about the issues that are plaguing birthing families of color. Black mothers and babies continue to disproportionately represent the number of maternal and infant deaths in the United States. Over the past few years, while more attention has been given to the issue, there still has been very little change. Black women still have 3 to 4 times more likely to die from a pregnancy-related cause compared to their white counterparts, and Black babies is twice as likely to die before their first birthday. We know that these outcomes are eradicated based on Black women, are not eradicated based on Black women's income, education, marital status, or when they started prenatal care. Access to prenatal care does not mean access to quality, cultural, appropriate prenatal care. This maternal health crisis is due to many compounding factors and social determinants of health, which are societal and systemic issues, all rooted in implicit biases, inadequate care, and sometimes issues with racism. The well-being of a Black mother, ultimately affects the entire trajectory of her children, her family's health, as well as the overall health of the community. This not only plagues Black families, but also all birthing families. Black Maternal Health Week is designated to bring awareness to the issue of Black maternal health crisis, to advocate for the success and survival of Black mothers, and to push for research and solutions to the problem that Black mothers face. This also gives us an opportunity to look at ways in which we are centering and elevating the voices of Black mothers and families and other families of color to find solutions to the problem that they are facing and how best to address them. So this week, you will see many variety of activities going on surrounding Black Maternal Health Week, which started April the 11th and goes to April 17th. But it allows Black families and Black mothers to share their success stories, tools and mechanisms they use to stay healthy, and tips on how to navigate difficult experiences and situations for their mental, emotional, and physical well-being. The lived experiences of Black women are valued and need to be heard. So the person that will be moderating this session this afternoon and hearing some of our family voices and voices of professionals who work with the family and in the community is going to be Aisha Lemkins. Let me give you a little bit of information about Ms. Lemkins. Aisha Lemkins has over 20 years of experience in government and nonprofit sectors. She is a trained facilitator who has spent over 15 years leading sessions on topics such as teen pregnancy prevention, HIV, STD testing and prevention, suicide prevention, and the effects of institutional racism. Aisha currently is employed with the Oklahoma State Department of Health within the Maternal Child Health Assessment Division, where her work is focused on reducing infant mortality. She is the project manager for 2 statewide survey programs, which is PRAMS and TOCS, that collect data to improve the health of babies, toddlers, and mothers in Oklahoma. So at this time, I'm gonna now turn over this session to Ms. Aisha Lemkins. Ms. Lemkins?
Thank you so much, Kamisha. And I still say that is a huge picture on the screen. So thank you everyone for joining us today. This is a very important topic. Self-advocacy is important, and it's a critical part of pregnancy and childbirth. It's critical to be able to know what you feel, and that's physically, mentally, emotionally, and then to be able to communicate those needs as a birthing person or as a birthing family. As a Black woman and as people of color, unfortunately, the legacy of racism and oppression still tends to reach out and silence us in lots of areas of our lives, but including through our birth processes and our birthing experiences. Knowing how to advocate puts some of that power back where it belongs, and that's with you. And it helps ensure that your needs are being met. And I want to acknowledge that kind of this taking on of power, it can simultaneously be freeing and also can carry a lot of weight. But until we have widespread systematic changes, we need to know how to advocate for ourselves and for our family. Truly, no exaggeration, our lives depend on it. Our guests today will help contextualize and situate advocacy from their own perspectives. And so with that, I am going to introduce them now. Our first speaker will be Jillian Bray. Jillian is an Oklahoma native and an advocate for reproductive and birth justice. She is a graduate of the University of Central Oklahoma and the creator of Better Black News. Better Black News is an online media company that highlights people of African descent in a more positive light in the form of news stories. Jillian is also a wife to Michael Bray II and the mother to two wonderful boys, Janori, who is 3, and Michael III, who was there on camera and who is 2 months old. Next, we'll have Velvet Brown Watts. Velvet L. Brown Watts is the founder and chairperson of Supporters of Families with Sickle Cell Disease Incorporated, along with her partner, Jeremiah Watts Jr. Supporters, as it's affectionately known, is a community-based Oklahoma nonprofit organization that has assisted families living with sickle cell diseases since 2004. This comprehensive grassroots family support and advocacy organization in Oklahoma serves as a center for contact and referral service for community resources to assist individuals with sickle cell and related diseases. Velvet is an inspirational voice in the sickle cell community as a pioneering executive, social worker, and community activist. Velvet has spent over 20 years in social services, serving on several nonprofit community boards and volunteering with many different organizations in the Oklahoma community. She has conducted several workshops for various agencies throughout Oklahoma on the impact of sickle cell disease and sickle cell trait. So with that, I'm going to turn it over to our first speaker, Jillian Bray, to speak to us about her personal story of birthing experience.
Well, hello, good afternoon to each and every one of you. I'll keep it short and sweet because I know we only have a whole hour for this time allotted. So I don't want to bore you with my story. But with my first son, who's 3, he'll be 4 in June. It was really important to me to have people on my birthing team that had the same views and concerns that I did. Of course, I was afraid and read the statistics about how Black women are more likely to die from childbirth complications or through childbirth more often than white women. So that, of course, put a lot of fear in me. And I didn't want to have that fear take over my birthing experience. So I tried to make sure I was well educated. So I was going to do the traditional route of going through the hospital and everything. But I didn't like that everything was so cookie cuttered in the hospital. I didn't like that. I like more of a letting nature take its course. I didn't like that if I wanted my birth to be by a Black doctor, we would have to schedule an induction. And I didn't like that. I wasn't comfortable with that. So I equipped myself with my own knowledge with researching on other options that I could do, that I could take over and see what was better for my family. And so I ended up contacting my midwife, that her name is Taryn Goodwin. She's amazing. I had my doula, who was a Black girl named Renisha Franklin. I love her. My birth assistant, Megan Jennings. She's Taryn, one of her assistants. And my whole birthing team, we were just all well educated, knew exactly what I wanted to do. I wanted to have a water birth. I wanted it to be uninterrupted. I didn't want any like things to like push my labor or to make it go faster. I didn't like that. So we went ahead and did the whole route of going and renting out a birth center. Everything was great until like I guess the last day of my labor. I labored for 3 days. My midwife, who's very well educated, thankfully she knows when things are not going the way they should. She was in tune with everything that was going on. And so she was like, I think we probably need to transfer. So unfortunately, I guess I should say fortunately, because my son and I are here today. Unfortunately, fortunately, we ended up transferring to Mercy Hospital. I ended up having to have an emergency C-section. And of course, that was devastating to me because that's not what I wanted to do. I didn't want to have an experience like that. And I was just like, I was scared. I had all these emotions because I would hear all these bad things about, Black women in the hospital. And I was just afraid that maybe I might die. And just, it was almost a horrible experience. Well, the silver lining that I have in that was that night that we transferred to the hospital, lo and behold, a Black doctor was on call, Dr. Carrie Anthony. And I still cannot find this woman to this day. January will be 4 in June, and I still can't find her to thank her again. But she was on call that night, ended up doing my emergency C-section, talked with me through the whole process, told me, when she was going to do the incision, was very just caring. And she didn't have to do that. She was almost the exact opposite of what I read about, when it comes to doctors and hospitals. And I was overcome with emotions. Of course, I was upset I was having a C-section, but on the other side of that, I was grateful that it was a Black woman who was there, like literally almost holding my hand through my C-section. After the C-section took place, she did something she did not have to do. She came up to my room, literally held my hand and like looked me in my eyes and, told me, she's like, I know you didn't get the birth that you wanted. This wasn't what you were looking for, but I wanted to let you know that you're a great candidate for a VBAC. Of course, I'm still very upset, crying and just upset that I had this experience, it was complete opposite of what I wanted. Did not want a C-section. And she was like, I know you're upset, but I just want you to know, if you ever have any more children, please try to have a VBAC. And I'm like, nope, not doing a VBAC, not having more kids. This was traumatic. I'm not doing this anymore. Like, this was just too much for me. And she said, no, Jillian, it really was not you. It was your baby. It was not your body that failed you. I really think you should do this, give your body another chance. And literally almost made me like convince me to, if I had more children to do it. And she did not have to do that. I mean, came to my room, held my hand, looked me in my eyes. I mean, I'm pretty sure she had other things she could be doing, but took time out of her schedule to come to my room. She didn't even know me. She didn't know me from anybody else, and came and like just talked to me and made me feel good. Even though I was still sad, made me feel good. And I kept that in the back of my mind. Well, let's fast forward, 4 years later, by this time I'm married to my amazing husband, Michael II. We have our first baby together. We're a blended family. And I remembered what Dr. Carrie Anthony said. And I, spoke with my husband. I told him that I wanted to have a VBAC, if he could support me and help me, achieve this goal. I contacted Tara, my midwife that I had with January, and I said, let's try this again. Let's try this again. I'm not letting the C-section scare me into, opting for another C-section with this next baby. Of course, in that moment after I was having a C-section, yes, I didn't want to have any more children or try for a VBAC or whatever, but time went on. I processed the information. I processed my birth story that happened with January, and I was able to, come to terms with it, that everything sometimes doesn't happen the way you want it. It may not happen then, but it'll happen later maybe. And so I was willing to try. And thankfully, I gave birth to my son, who I'm nursing now, because I wanted him to be on camera with you guys, but he was too fussy. So he's nursing and about to go to sleep. Thankfully, I was able to have a VBAC with him February 4th of this year, with my midwife, no medication, nothing. I mean, I felt everything. And I was able to successfully do it, trusting my body. I had, like I said, the amazing birth team. My husband was a great support system for me. I mean, he was there cheering me on. And that is so important when a woman is in labor and she doesn't feel like she can do it. She has to have that support, because it got dark for me. It really did. I just didn't think that I could do it because the pain was too much. And my birthing team was there to cheer me on. I'm like, no, Jillian, you can do this. You came too far. And thankfully, we were able to successfully have my VBAC. And I'm a proud mama of a C-section baby and a VBAC baby. So yeah, that's my story. I tried to, make it short for you guys, but yeah, that's my birth story.
Thank you for sharing. And just as a reminder, if you all have any questions, go ahead and put them in the chat. You don't have to wait till the end. You can go ahead and start plugging those in now so that we can address those at the end. So thank you again, Jillian. A couple of things that stood out as we get ready to transition to our next presenter. One is the importance of culturally competent care and having doctors that will actually not just listen to you, but hear what it is you're saying, and maybe even just pick up on your body language. So maybe at first, like VBAC wasn't in your head, but the fact that she was like, no, you're a good candidate for this. This is something that you should consider.
She didn't even know me. She did not know me.
So, I mean, that's great. And then also a support system, how important it is to have not only the birthing team, but to have others that are with you who are supporting you through this whole process makes a huge difference. So I'm sure there'll be some questions. You guys put them in the chat. Next up, we are going to have Velvet Brown Watts share an organization story on sickle cell's impact on pregnancy.
Good afternoon, everyone. I am so excited to be here to talk about sickle cell disease and pregnancy. We brought our sickle cell ambassador. Her name is Shaquanda, and she is a mother of one and is expecting a new baby. And so I'm just going to give a little bit of background about sickle cell disease, what it is, and some of the complications that can be associated with pregnancy. So sickle cell disease is an inherited disorder. It is an inherited blood condition. And individuals who are born with sickle cell disease, they carry the sickle cell, parents carry sickle cell trait. And it takes two people who live with sickle cell trait to have a 1 in 4 chance, 25% chance each pregnancy to have a baby born with sickle cell disease. As a mother of a young man who lives with SCD, my son is 17, I can attest to carrying and not knowing that my son would be born with sickle cell disease. Both my husband carried sickle cell trait. In Oklahoma, they didn't begin testing until 1990. My husband was born way before then, so he was not aware that he carried sickle cell trait. So it's very important that people understand what is in their genes, and if they carry anything that can be passed down through the bloodline to their unborn child or children that they may have. So I believe education is very important when it comes to understanding the genetics of sickle cell disease, but also getting that information either pre or post conception as well. So when we think about sickle cell disease as a hemoglobinopathy and the increased risk that comes with pregnancy, we understand that things can be very complicated for women living with sickle cell disease and pregnancy. I've heard of wonderful stories, and I've heard of very challenging stories from women who had babies while also living with sickle cell disease. So some of the complications that people could see were preeclampsia, preterm labor, anemia, and hypoxia. We believe that women who live with sickle cell disease and want to have children should be able to have children. And we believe that they need team care. That means that everyone that's part of their care team should work together to help provide the best options, the best medical care going forward so that they can have the best chances of having a very healthy baby and also keeping mom safe. And so we definitely want people to understand that you can have successful pregnancies if you live with sickle cell disease and are having babies. We believe that you should understand what is going on for and about your body, and advocate with your care team to make sure that everybody on the team is on the same page. And so part of that means that your hemoglobinopathy issues and the hematologist should know what the OB-GYN knows. They should be working together. And if you have any other specialty physician, everybody should know what's going on. Shaquanda will definitely be able to attest and talk more about some of the challenges and the ways that she has had to advocate even recently around her care and as she carries. And so we want people to know that there are resources. We have a new group called Sickle Cell Red. This particular organization is everything about reproductive care. And of course, that's reproductive health, that's pregnancy, conception, contraception, priapism, menopause, fertility, family planning, sex hormones. This particular agency is focused on it. And we're so happy because in the sickle cell community, that had not been a huge topic or focus on many spectrums for our community. So we're really, really excited about this particular nonprofit taking up the call to action on our reproductive health within the sickle cell community. And then you also can find various literature through various journals, and in particular, the National Library of Medicine. They have lots of different types of articles around sickle cell disease and pregnancy. Also on the National Office of Minority Health page, there's information around sickle cell disease and pregnancy. So we are just really excited to be part of this week to bring attention to women who live with this genetic condition, and wanting to make sure people understand you can have a healthy pregnancy. It requires putting together your care team, making sure everyone is on the same page, and learning how to advocate for yourself. And so at this time, I'm going to introduce you to Shaquanda Lewis. She is the sickle cell ambassador for Oklahoma. She has one son, Levi, just turned 5, and she is expecting another baby. And so she can actually give you some lived experiences of having lived through one pregnancy and going through another one, as she is someone who lives with SCD. Shaquanda.
Hello, everyone. I am Shaquanda Lewis, and I'm so excited to be able to come and share my journey. I knew just becoming an advocate has been a passion of mine because I get to tell different parts of my life that I've never experienced and that I have experienced, and the things that I learned in both of those. So when it comes to me being pregnant and learning about sickle cell and what can happen and cannot happen while pregnant and living with sickle cell, during my first pregnancy, I had really just got on a track of being focused on what I need to do to better my health and better just my life living with sickle cell. So becoming pregnant in that time is all of what I learned about sickle cell. Just I had to combine that with being pregnant and learning how to combat pregnancy and sickle cell. My first time around, I did not have a team who all worked together. And I was confused on everything. I didn't know what to do, how to do it, but just going through the process, I remember, not feeling like I had sickle cell because of so much I was just trying to learn at that time. So just the difference within my pregnancies. Now I do have a team. I'm working on getting more people to become a part of my medical team during this pregnancy. I am 5 months now, so it's very critical right now that I have all this together before I give birth, because I don't want it to be the same where I just got stuck and confused and did not continue to just go for what I needed. So my first experience was, I knew I didn't want the same experience. And that's what I'm fighting so hard for with this pregnancy and medical team. So like I have my OB, I have my high risk, I have my cardiologist because I have an enlarged heart, and I have my hematologist, and I applied for a doula. So with those 5 things right now, that's the most that I've ever had on my medical team. It was just my OB and my hematologist the first time around. And that wasn't a medical team. And they wouldn't going back and forth and communicating to see what is best or what isn't best. So this time around, I took it upon myself to make sure that I ask questions that I think the other doctor would ask, the same doctor. And then when I do that, I want to make sure that the information or the question that is being asked, that I can make sure and go back and ask that same doctor, not only for just good communication, but for my knowledge. So far, I have been able to understand the opioid and medicine things that happen with when you're pregnant, and that's just the medicine that you have to take to help with your pain. I never knew that. Well, I knew that it can help, can harm the baby in a certain way, but I didn't pay it any attention my first time around. Like I just didn't need to go to the clinic to get any pain medicine, and the pain medicine that I got when when I was admitted into the hospital, it was just morphine. So I didn't technically understand this time around of why I couldn't get the morphine and all the other meds. So I wanted to become more responsible with regulating how often I go to the infusion clinic and how often I need pain medicine. And so far, within the last 2 months, I have not visited my clinic, the outpatient infusion, because my doctor decided that he wants to control the situation instead of let me make the decision for myself when I feel pain. So that's one part of where I am becoming a little weary of, is because of the way he's being toward the pain medicine. And I told him, like, I more than understand that the pain medicine is not safe as of now, but I also understand that there is a reason why I need it and the reason why it should be given. And since then, I've only been getting 1 milligram of pain meds whenever I go to the outpatient infusion. And that is usually 2 days, but since then I've went and I've gotten the 1 milligram. I've done the second day without pain medicine, and I felt great and it was fine. But I went into a crisis in late March, and I had been having chest pain for 7 days, and I finally just went to the hospital. And I was told that I was in a crisis, and whatnot. So my visit to go see my hematologist after the hospital was very uneasy. It felt like I didn't get anywhere with how far I've came from not understanding the pain medicine to understanding that, okay, this is probably the safest thing to do. I don't need the pain medicine. And if I do, I know how to regulate and use just what I have around me, which is Tylenol, and that's it. So in the hospital, I talked with multiple different doctors, And I have my OBG and my high risk doctor, and a hematologist came and saw me. A cardiologist did the echo on my heart and all that. And when I told him these things, he told me that I was lying. And that right there, like, that's something that I'm trying to fight so hard by becoming an advocate to stop in the medical field. Just because you don't see or understand or receive anything from another doctor does not mean a patient is lying. So I had my OB write a letter to him explaining why it's important that we understand what's going on with me versus just the baby, because if I go into a crisis, it can hurt both of us, not just me, it can hurt the baby too. And what we don't want to do is to have anyone going through anything. And I felt like that was the best thing that he could have said to me, because it gives me more power to be more involved in my care and what goes on with me while I am pregnant. So those are like the differences that I've noticed within both pregnancies. Even now, I don't feel as if my sickle cell is as bad. And I know, like, after birth, it can get bad, because that's what happened in my first pregnancy. Afterwards, it got really bad up until my son was like 7 months. But I know I'm learning to regulate everything now being pregnant. So when that time comes, I know what to do versus just being clueless and just going with what or whoever tell me in the medical field. So it's really a purpose that I'm going through this again, and it's always going to be my passion to tell my story and to get better understanding, not just for myself, but other people around me who are going through the same thing. So being an ambassador and advocate and what I'm becoming of myself is very important, not only for me, but for my kids, so they know that through all things, mommy cared and mommy did her best to be educated about everything that's going on with her, so she can educate us on better healthcare, better interactions with medical doctors, and just all of that. Like, I want my kids to know what they're getting ready for, and when it comes to them being older in life. And the medical field is one of the biggest thing for me, because who knows what might happen with me, and they may have to speak for me. So I really need to be able to understand and know these things so I can pass it down to my kids. Thank you.
Thank you so much, Shaquanda, for your story. We really, really, really appreciate it. As you all heard, Shaquanda talked about her experience with dealing with her first pregnancy versus her second pregnancy, and understanding how important it is to have a team. It is so important to have a team when you live with any chronic condition, and particularly those who live with sickle cell disease. Industry best practice is for us to have team care for our families. We call them families, not clients, not consumers. They're our families. And we want to make sure that they're getting the best care they can. We are so excited that Shaquanda is learning basically what she did the first time and now what she's doing the second time, because you are your best advocate. You know better than anyone else your body. And so that's very, very important when you are dealing with any chronic condition, whether it's sickle cell diabetes, lupus, whatever the case may be. You are your best advocate, and having a team around you that understands that you are educated about your body and the things that you go through can be very beneficial when coming to getting best health outcomes. We want to thank you so very much for allowing us to participate. As I said, that we are so, so excited about just putting a spotlight on Black Maternal Health Week and how important it is for our moms and our babies to be healthy and to grow health. Thank you so much.
Thank you, Velvet and Shaquanda. I wrote down just kind of a few take-home points, and Ms. Velvet, you kind of hit on one of the first ones that came up, and that's the importance of having a team and making sure that that team is on the same page. So it doesn't make any sense that if you have a team, but the team isn't communicating or isn't on the same page about the type of care. So that seems like it was something that was very important. Also, the importance of education, not only about your sickle cell disease, but also knowing what happens to your body during pregnancy. And as Shaquanda said, postpartum, because after delivery, there were some things that happened that she didn't anticipate. So making sure that you have education about those things as well. And asking questions. I think that that's an important point. Regardless, that goes across whether we're talking specifically about those women who are giving birth who have sickle cell disease, or just giving birth, period, or just going to a doctor. It is important to ask questions, and it's important to make that team or those doctors or whoever is involved explain themselves. So if you don't understand something, then they need to say it a different way, because before you leave, you need to understand what exactly it is that they are wanting you to do or what the next steps are. So making sure that you are asking questions and that whoever is on your team is explaining things in a way that you're comfortable with, in a way that you understand. And then the fact that you can have a healthy pregnancy. I know several people that also have sickle cell disease, and they've been told that pregnancy isn't an option for them, just a blanket statement. So knowing that a healthy pregnancy can occur, there's just some other things that might need to be taken into consideration, I think is something that a lot of women may not know. So I think that that's important as well. So I touched on the importance of asking questions, and actually that's where I'm going to shift to right now, and I'm going to ask questions from those who participated today, Jillian and Velvet, and also Shaquanda, if you want to jump in and answer some of these questions as well. If you all who are attending today have other specific questions, then go ahead and put those in the chat, and we'll make sure that we get to them. I do have some standard questions, and I'm just going to ask that our panelists just go ahead and answer each question, and then we'll go on to whatever is in the chat. Okay, so the first, according to the CDC, anywhere from 700 to 900 women die each year in the US due to pregnancy or delivery complications. This is something that Kamisha kind of already touched on in the beginning. The maternal mortality rate in the US is high. It's highest than any other developed country in the world. So focusing on maternal morbidity and mortality, what do you feel are the issues that create an increase in morbidity and mortality for Black birthing families? I'll read that one more time. What do you feel are the issues that create an increase in morbidity and mortality for Black birthing families? And anyone can just jump in.
I say it's the lack of resources and the lack of knowledge. Knowledge is power. So if we're not equipped with knowledge of knowing what our options are, that can be detrimental to our health, our family, the state of just our sanity. So for sure it's knowledge. Speaking personally, just things that I didn't know going into the second pregnancy that I didn't know with my first pregnancy, it just changes just the shift on a lot of things. So I just think knowledge is for sure holding a lot of our families back. They don't know their options. They don't know what they can do. They don't know what they can do, what they can't do. So that's what I say.
I also think it's the lack of accountability in the medical community. I think that ignorance is not an excuse any longer. There's too much technology, too much information that people can choose to get in the medical community. I think one of the big hindrances that I see is biases and also preconceived ideas around culture. I think there's a lack of understanding how our culture intersects with pregnancy and our families. And I just think there's a lot of people within our medical communities that still have not truly taken the step to eradicate institutionalized racism. And so I think that barrier right there puts us at a disadvantage, especially our moms. And when you couple that with the lack of education on our part, because we don't know, then we're left depending totally and solely on the medical community. And sometimes you can't put your life in the medical community hands. You got to know for yourself. I tell people every day, look, you need to know for yourself so that if something comes up, you can go back and research it and look at it and say, wait a minute, as you said, ask the questions. So, and don't let them leave until you've gotten an answer that you have peace with and comfortable with, so that you know what is being said. Yeah, okay, I can do this, or no, maybe we need to look at something different. So I think those are lack of accountability in the medical community and the lack of education within our community can really be detrimental.
Also, I want to piggyback off of what Velvet was saying, is that they will build a narrative based off some of the things that you say when you answering their questions about your health and your background and all that stuff. And then that narrative changes over time because they're not really caring about what you're going through. They're just hearing what is going on and they build that narrative based off that, and that's how they decide to care for you.
Thank you, ladies. Now, some of us have heard the story of Kira Johnson, which sparked conversations regarding maternal mortality. She was a young mother, she was 29 years old, who tragically died from internal bleeding following childbirth. Her death developed from a laceration of the bladder during a C-section, and that happened 12 hours after she gave birth. It was discovered after the autopsy that she died from hemorrhagic shock. So in other words, because of significant blood loss, her body went into shock. In self-advocacy, as a birthing family or as a birthing parent, what advice would you provide a birthing family about speaking up for themselves during the birthing process? I think we've kind of touched on this a little bit, but I really want to kind of drive home the point. What advice would you provide a birthing family about speaking up for themselves during the process?
So my birthing experience the first time it was okay, but it was terrible because they were trying to induce me, and their process of inducing me, I felt like it was backwards, because they didn't use the medicine that gets you induced. They tried to do it by hand, and it was very uncomfortable. And I was telling them, I was like, this isn't working. This isn't working. So I just feel like if they're not paying attention to what you're saying or how you feeling, I feel like that should be the time you address it, not only with the doctor, but also even a different doctor, just telling you want a different doctor. I did not do that because I just didn't understand what was going on. But after of hours of enduring the same type of pain below, I just wanted them to stop and just leave my body alone. So after just birth and all that, it's just I didn't feel right. in my area. I felt like it was just too many hands inside of me, and I dealt with that for a long time, just wondering like, why did they choose that route to get me induced? I still just did not understand. So I just feel like if it's uncomfortable, stand up for yourself right then and there. Don't allow it to go on hours and hours, because it can really internally do something to you.
I also think that we need to understand our rights. We need to understand our medical rights, our patient rights. We need to understand the hospital policies and procedures on how we have to go through various things, whether it's getting the charge nurse, the house supervisor, calling administration. You have to understand the system, and you have to understand what it means. And it may mean at the end of your stay that you're safe, but you're going to take a hit. I'm not going to tell you you're not, because that's what they do with us, but you came out alive. And so, or your child came out alive. You have to be willing to speak up and voice what you are going through. A lot of times, my mother's a nurse, and I tell people she's one of the old school nurses, used to wear that. She wear the hat in her school, the white hat and the dress. And the one thing she said to me, she said, we have a lot of patients that come in of color. They do not ask a question. They get home and then they call me. And she says, you were right in here with the doctor. Why didn't you say something? It's because there is a history of trauma that's related to us not asking or voicing what we think and or feel. And I think that we have to change that narrative. We have to begin to say that you're worthy of quality care. You deserve quality care. You deserve to come out of this to your family. What is it going to take for us to get on the same page? I tell people, I when you're pregnant, have you someone there. Never be by yourself. Never be by yourself. Don't even let them leave you by yourself. Have someone there, and have someone that's knowledgeable that can say, no, we need to, I call them to come to Jesus meetings. That's when I bring everybody in. I bring the floor manager, I bring the house supervisor, I bring the social worker or the patient advocate. I bring everybody in. Let's have a care plan meeting right here, so we understand we're on this same page. And then once I've had the meeting, and if I have to go to medical affairs, you can't say I didn't have a meeting. I didn't tell you what I needed. I didn't tell you what I needed us to do and the direction we needed to go. Because a lot of times, even in the hospitals, especially if you have complicated cases, they're working in a silo. And some cases you cannot work in silos or you'll miss things. And so, I encourage all families, get you a birthing plan. I encourage all our women, write you a plan up, get you a plan A and a plan B. Plan A is if everything goes exactly how I want it. Plan B is if I got to go into something emergency. That way you are not left feeling so out of control. And I think a lot of times when we're in the hospital, especially giving birth, you can kind of feel out of control because nothing's really in your control. And you're just trying to grasp a little bit to kind of settle yourself. And so those are some of my recommendations to families. Understand the policies of the hospital, understand your patient right, understand that you can say stop. You can say stop. And I think, and then don't allow, because sometimes we can feel like we're pressured into decisions. And you have to be very careful with that, because you're trying to figure something out and everybody is coming at you all at once. It can be overwhelming. So that's why it's so important to have people there with you.
Yeah, I agree with that. And it kind of goes back to that support system piece. And so having people in place that actually know your birth plan and can help you execute that. When my first son was born, I actually had a traumatic childbirth experience. I had a birth plan, I had everything laid out, nothing went according to plan. I had an emergency C-section, and I was so emotional because this was not how I had things planned out, that I could not vocalize in a coherent way what needed to happen or what I wanted, or anything. And so luckily my husband was able to step in and do that for me. It's like, no, okay, is there anything else? Is there any other thing that we can do? Okay, the Pitocin isn't working. So how much longer is she going to need to go on the Pitocin before something else happens? And I was also blessed because, I mean, my doctor, my OBGYNs were Black females. And so they kind of walked me through everything, but still, even with that, I still needed, a support system. I needed someone there to help, to be able to vocalize and speak up for myself when I couldn't, just because of the emotional trauma that was going on at the time. So I think that makes a big difference, which leads into our next question. How do family and friends, how do their perceptions of the healthcare system impact the decisions that are made during the birthing process? How do family and friends' perceptions of the healthcare system impact decisions made during the birthing process?
I think if they've had any traumatic experience, it can sway one way or the other. If my mother's a nurse, so she has a certain perspective of the system versus my husband, who may not be as well versed in the medical system. And so depending on his own experience with the medical system, doctors, nurses, whomever he's come into contact with, that can sway you within your birthing process. So my example is my birthing process with my son. I had gallstones. I was on bed rest from 6 months on. And so I had to, they actually thought about doing a operation during my pregnancy, which would have actually potentially caused me to lose the baby. And so we had to really weigh that out, the risk of having someone actually do surgery while you're pregnant. And so I chose not to. That was a very interesting process. But if I had not kind of had some people in my corner who understood some of the things in the medical community, I think I would have made some other choices. And I think that when we have families, if they've had any traumatic experience in the hospitals or with facilities, it can make them more guarded. It also can make them more heightened as far as if something begins to go wrong with you. And so it can work one of two ways. You may have someone who is very aware because this is what happened with them. They may see the signs and they can react very quick. Or you may have someone who's very fearful. And that also can put you in certain types of situations because now they're scared. And so you just have to be very careful. I try my best to encourage all our families that if you're going to go into the hospital, especially those who are pregnant, if they've had any traumatic experiences, have a conversation. Have a conversation so that you know that if they get in there, they actually can help you and not do something different.
That's good. Thank you. Kamisha, I know that we're running short on time. Are there some questions from the chat that we can get to?
Yes, so there was one that was asked early on during Ms. Jillian Bray's story. The comment says, thank you for sharing your story, but the question asks, did you deliver your second baby VBAC at a hospital? And did you receive prenatal care from a Black OBGYN or did that OBGYN support the use of doulas in the care team? So if you can give us a little bit information about if the VBAC happened in a hospital and then the coordination of your care.
So originally, yes, we wanted to have it at home. It was going to be different this time. The first time we were with Janora, we tried for a birth center. This one was going to be at home. That was our plan, to deliver in our living room in a pool. We got to day 2 of my of the labor, and I got to an 8. My midwife checked me, and I was at an 8. And when you're at an 8, you should be, your cervix should be completely like open, where it's not effaced or anything. Well, for some strange reason, I wasn't completely effaced. I had a little lip of my cervix on there. And so since we were at an 8, I had already passed my not my mucus plug, but some liquid. I had already passed some liquid. So we were getting in a danger zone of time is of the essence. So since we were at an 8, my midwife, of course, again, it's very important to have educated people on your birth team, because she could have been one of those people that was like, no, we can still try it. Let's still try this at home. And, could have died or something. But no, she's very well educated and listens to her clients and, encourages us to trust our bodies. And so when she checked me, when my cervix wasn't completely effaced, she said, my suggestion and professional opinion is that we transfer, just to make sure there's nothing going on that we can't see. Because, when you're at home, obviously there's no medical equipment here because everything's, natural and everything. So we ended up transferring to Mercy. That's where I had my C-section with my son. We ended up transferring. Thankfully, the trip there must have did something for my body, because en route to the hospital, something happened to where my cervix completely effaced, because when I got to the hospital, I was at a 9 and my cervix was completely dilated. So we were able to deliver successfully at the hospital there. And I wonder what happened, why that happened. But after we gave birth to my son, I didn't include this in the beginning because it would have been too long for time. But after I gave birth to my son in the hospital, I ended up hemorrhaging. So thankfully, my midwife was very educated on, she couldn't figure out what was going on. I think that was my body telling us, no, we don't need to have this baby here. You need to have this baby at the hospital. Because after, my son came out, it was just crazy. I don't remember a lot of things. I have to depend on my husband and my birthing team to tell me everything, because I just remember being kind of like out of it and being really sleepy. And I learned that was because I lost so much blood. Ended up having to get a blood transfusion. This was in the middle of a snowstorm. So if I would have had my baby at home, who knows if I would be here today. So it almost makes me emotional talking about it. But yes, thankfully, my midwife was educated enough to know that something was wrong with my cervix not being completely dilated. We delivered successfully at the hospital. I say successfully, even though I hemorrhaged, because I'm here today. We did the transfusion at the hospital. Like I said, there was no drugs involved, no epidurals. It was too late for that anyway. But yeah, I got my blood transfusion. I'm good. Baby's good. Thankfully, we listened to nature, and yeah, we're here today.
Do we have time for, excuse me, one more question, or do you have a closing question? We have one more in the chat.
Let's get to the one in the chat.
Okay, so this is the last question that we'll have before we wrap things up. What can be done to change or close the gap of the healthcare disparities, such as socioeconomics, even the women who uses the state plans when they don't get the same treatment? So what are some of the ways we can, or some changes that could be made in regards to the healthcare system to address those gaps?
Can they expound on that a little bit more so that I can have a better understanding, please?
So I think that what's being asked, we have some women who uses the healthcare system, especially those who have challenges as far as financial, or may use state-funded plans, socioeconomic challenges, and use state-funded plans who don't receive the same treatment. The question goes around, how do we close those gaps to make sure that we have quality care for all?
Okay, so let me repeat this back to you so I make sure I'm understanding what the person is asking, that versus commercial or commercial insurance versus like state planned insurance, and maybe those plans do something different than on the state plan, and how do we close those gaps? Is that correct?
I think more it's looking at difference in socioeconomics and treatment in the healthcare system, I believe. How do we close those gaps between one population from the other so everyone's on an even playing field? What suggestions?
I think we have to address policy. I think that until we address policy and then put funding behind policy and make it where policy, you can eradicate biases in policy and then make them accountable, so that then you are on an equal playing ground, so that women of color get the same type of treatment that other women who are not of color would get. We have to address policy. We have to address hospital policies, and we have to address our medical community. When people are in school and they're learning, you know, I tell people, I know because we've done some of the grand rounds and it's empowering to bring in groups of people of color to medical communities, because they get a different perspective. It's what Shaquanda said. It's the narrative. It's the narrative that everyone is told about one community versus another community. And I think we have to address that through education. We have to address that through advocacy and awareness. And we have to address it through policy, also funding the policy. Because I can do a policy, but there's no money behind it. It's an empty promise. So I need to make sure that those things are being done. And then we got to be at the table. That's the other thing. If you're not at the table, you're on the menu. And we got to be at the table. And we got to be at the table from the onset, not an afterthought. We have to be at the table so that we can make sure that people understand that we have a voice. And, you know, we may not represent everyone that looks like us, right? Because we're very different, even in our own culture. But we have a voice to say, hey, have you thought about it this way? Or can we do something different in a different way, so that we can make sure that there is some equity and equitable access for our families?
Yeah, that's good. Jillian, last words that you want to share with us today?
I think what I want to leave with you all today is just to always make sure we're listening, especially people who are on this call that don't look like me and you. Like, just listen to what we have to say. We're not just talking out of our butts. Like, just, you know, listen to us, advocate for us, because sometimes it takes the voice of others. We need those people who don't look like us to cheer for us, because sometimes that's what it takes to get those other people who don't listen to us to listen to us when they see somebody who looks like them. And I hate to talk around the bush, but y'all know what I'm saying. So that's what I would like to leave today.
We got you. We got you. Shaquanda, last words or thoughts that you want to share?
My last words and thoughts will be, just make sure you're an advocate for yourself and for what you have going on. Speak up for what you know and what you know about your body, so everyone can be on the same page. Include everyone, ask those questions. Even if you have to ask them to 2 or 3 different people, ask those questions so you can get a better understanding of what you're going through in life. Although you mentally know, you medically will need to know as well. So just ask those questions and support yourself, educate yourself, keep the knowledge, share the knowledge, advocate.
It's very good. Thank you all. Thank you to Velvet, Shaquanda, Jillian for sharing your insights. I am going to now turn it over to Kamisha for our last remarks for this session.
Yes, thank you, Aisha, and to all of our panelists that we had. This was some great discussion today and talking about self-advocacy. So sometimes it's very challenging navigating through the healthcare system. And us as providers, we have our mechanisms, our strategies, our ways that we could improve access and different things of that nature, but it's different when we don't have the community voice at the table to say exactly what they're needing. We can come up with great plans, but if we don't have them at the table in the discussion, in the foundation of building that framework to help these families and these communities, then we're doing it for naught. So I'd like to thank everyone for participating again. Thank you for those who have engaged in some questions. I have on the screen here, we'll have some additional events that will be coming up, that will still be observing, excuse me, I took it down by accident, that will still be observing Black Maternal Health Week. Will be going on until the 17th. So if you're in Tulsa, please reach out, or near Tulsa, please reach out to the Tulsa Birth Equity Initiative. They have some great programs that's going on. And then, of course, with our state, along our state, we'll still have some great conversations and some things coming from March of Dimes and other organizations about the topics that's important to Black maternal health. And also too, make sure that you follow the Oklahoma State Department of Health, the MCH, Oklahoma Maternal and Child Health. Follow us on Facebook, because not only do we share topics about Black maternal health, we share topics about every other groups that have some disparate things going on with them, and some good information that's out there. So stay tuned on a lot of other things that's up to come. Again, I'd like to thank Aisha publicly for facilitating the session, and you all have a beautiful Thursday. Thank you again.